If you ask me to explain ACE inhibitors as your nursing tutor, here's what I'll tell you. ACE inhibitors end in PRIL, so we're talking enalapril, captopril, lisinopril, angiotensin converting enzyme inhibitor. Now, angiotensin converting enzyme plays two roles in the body. Stay with me. The first role is to convert angiotensin 1 to angiotensin 2. When it's needed, that angiotensin 2 will go to the blood vessels and cause them to squeeze really tight, which then raises the blood pressure. It also releases aldosterone, and aldosterone goes to the kidneys and tell them, hey, hold on to some sodium in water and pour some potassium into the urine for me. So when the patient gets an ACE inhibitor, it keeps angiotensin 2 from working on those blood vessels. So guess what will happen? The blood vessels will relax and the blood pressure will go down, and the body will hold on to less salt and water. Another job of ACE inhibitors is to break down a substance in the lungs called bradykinin. Bradykinin is usually something that can build up and cause inflammation in the lungs and irritate the nerve endings. So when you give an ACE inhibitor, it can also keep this bradykinin from being broken down. And so all of that bradykinin will accumulate in the lungs and stimulate the coughing reflex in a patient. Now that we know the backstory, let's talk about what you need to know about ACE inhibitors for NCLEX. Big side effect to know is that the patient can have a dry cough. And why is that happening? Because that bradykinin is accumulating and is causing irritation of those nerve endings. All we need to do is let the doctor know, because the patient can be switched over to a different type of medication to help manage their blood pressure. Another possible side effect is hyperkalemia. Now remember, I told you angiotensin 2 usually causes aldosterone to be released, and aldosterone then tells the kidneys to hold on to sodium and water and spill potassium into the urine. Well, if you block those ACE inhibitors, then potassium won't be spilled into the urine. It will be held in the body. You already know the relationship between potassium and the heart. So monitor the EKG, monitor the potassium levels. Make sure that you're watching for any possibility of the peak T waves, which may indicate hyperkalemia. Patients on potassium-sparing diuretics like spironolactone may be monitored closely. Make sure that you're keeping an eye on the potassium levels as well. If you found this video helpful, let me know in the comment section so I know that I'm doing something right, and share it with somebody else, a nursing student who may benefit from this explanation. As always, save it for your future study, and I'll see you on the next one, guys. Bye-bye.